Thank you very much. And thanks for the invitation to give this perspective talk or this interesting session. What I'm going to present in the next, hopefully 15 minutes is a bit the perspective of international organization on the importance of what we discussed until now, having innovative tool and having data, improved data, access to improved data. Some talking point just to present very, very quickly the organization, why it's important and why is it particularly important for an international organization to have an effective epidemic intelligence system in place. I'm going to discuss a bit the data availability, quality and tools, and also discuss about some key insight from the Mood project, and then to present some challenges, at least from our perspective, in the effective use of data and tools. So the organization, very in brief, the World Organization for Animal Health was founded in 1924. We have 183 members that are reporting important animal health events, what we consider exceptional epidemiological events to the organization against a list of priority diseases. And the main aim of the organization is really to improve animal health and welfare worldwide. Why is important, and as I said, why is it particularly important, the epidemic intelligence for an international organization? Because actually we are at the very end of the reporting chain. We discussed and we saw this morning the problem of delays in getting and sharing the information at the national level. For us, it's getting much more complex because we have to deal also with the next step in reporting, that is reporting for the national level to the international level, and then to share the information with the global community. And I'm helping myself with the definition of epidemic intelligence from Paquet, provided in 2006. Epidemic intelligence is really related to all activities related to early identification of health hazard, verification assessment, with the main purpose of facilitating decision-making, taking good decision with the information we have. Another important element of the epidemic intelligence is the integration of data from official sources and non-official sources, with a lot of problems we will see later. We will see later in further details. Again, why is important for us particularly? I spoke about delays. These are the delay in alerts we receive from members since 2005. Each dot basically is a disease event. According to our international standard, a country, a member, should report to our World Animal Health Information System any exceptional epidemiological event and alert with 24-hour delay. So the median reporting time from country to the international level for terrestrial animal diseases is 3 days. 10 days we are going to the aquatic animal diseases. And you see that we are speaking about median time, but actually there is a lot of dispersion and outlier up to 400 days that actually is not anymore really an alert. So converting the definition from Paquet in a flow of data, the main point in performing epidemic intelligence is really the risk monitoring and the risk assessment to inform the risk management and risk communication. And tools and data really should help in the risk monitoring part, really improving the early detection, early warning, early reporting of information, but also to improve the sensitivity of surveillance system, meaning that the surveillance system should, as much as possible, reflect the reality of the disease situation that are reported at the national and then at the international level. But it's also very important, the assessment phase. And so the important to have access to, and was something that presented yesterday, Elena, to have access to standardized way, and also to access to standardized way of analyzing data. The WOAH perspective and what we tried and we are trying to improve data and to improve tools are, first of all, since the 60s, the organization is producing and updating on a yearly basis international standard on animal health, including standard on how to establish surveillance system and reporting system. And this is updated on a regular basis based on expert opinion. But also we really are trying to work as much as possible on the tools to collect data. 3 examples of systems that are in place at the organization: the World Animal Health Information System. The first version was created in 1996 to allow countries to report on an online system. There was a second system in 2005, and then we renewed completely the system in 2021. In 2005, we received 50 alerts for exceptional epidemiological events. The number for 2024 is 10 times more. We are around now to 500 alerts received only in 2024. At the same time, and this is a work ongoing since 2002, we work a lot on the event-based surveillance side. So not just relying on official data, but also trying to see what we can get and how we can use unofficial data to feed the official information. And was a lot of manual work at the beginning. In 2017, we joined an initiative for the World Health Organization, that is the iOS system. And again, in terms of impact, we were able at the beginning of 2000 to scan and assess the reliability of few hundred news. And last year, with this system, we were able to assess and to scan and assess around 100,000 news. And finally, and this is the last one, is the GLUS Plus platform, that is really a collaborative platform at the quadripartite level, so that include information received from WHO, from FAO, sometimes from UNEP, and from us. And actually, the finding from the Mood project are exactly in line also with our effort to improve data and improve tools. I wanted really to highlight the PADI web, because the first time I was exposed to the PADI web was in 2022 during the Montpellier meeting, and I admit I was kind of skeptical on the tool, because the organization was using another system, and my main concern was why to develop something that apparently is doing something similar. And actually, when in the last workshop we have done last month, I really was convinced of the importance also to go for different to try to develop something different, not just to do, because at the end it's not a duplication. It's really the way was developed, the event-based surveillance system in PADI web. I realized develop some very original tools that, and the tuning system, the iOS, for example, the one we are using, and PADI web has quite a lot to share each other. And this is really something that can help in improving the risk monitoring. On the risk assessment phase, again, I think there is no need to spend more time on that, but there was a very nice presentation from Guy yesterday about covariate, about having a standardized way to do risk analysis. And also from the presentation today, I think all the presentation really show how the different tools, the different analysis, the different improved data collected by the and developed during the project can feed in and improve an epidemic intelligence framework. And actually, at the end of the day, all these tools on this data allow us to gain time. That means doing a risk monitoring, detecting earlier health threats, assessing more efficiently hazard, and take more timely decision. And when we are able to face with exceptional epidemiological event, risk of epidemic, of episodic events, really what we do not have is time. And so really, I think all these experiences are very valuable to make this flow of information much more efficient. At the same time, I think there are some challenges that have to be acknowledged. I just list a few of them. There are geographical differences in use and capacity of implementation of epidemic intelligence or implementation of tools. There is a human factor that is quite important to be considered, and also the tools and the data are very important, but is very important also what is around the tools and the data. That is really the collaboration. Just few words, I really always like to present this information that represent the outbreaks on exceptional epidemiological events reported to the organization since 2005. We are speaking about 180,000 outbreaks in all animals and disease in wildlife. And I think for wildlife, the situation is much more clear, showing that I always saying this does not represent the situation of exceptional epidemiological events at the alert level. It reflects the capacity of the different regions to detect and report the international level information. So actually what is clear from here is that Europe already is reporting, rough estimation I think is more than 60% of the outbreaks reported at the international level. So Europe is already quite well prepared. And why? Because there is large differences. This is one of the reasons in the surveillance system applied to different levels in the different countries. This is just a result from just don't focus on the score, but basically this is to show that there are each dot is a country, and the score measure the efficiency of the surveillance system in each country. As you see, the points are super dispersed. And again, for European region, and specifically this is not highlighted, but country in the EU space, so the average efficiency of surveillance system are much more higher than the global average. There is a problem of capacity building. It's important to have tools, it's important to have data, but it's also important to build the capacity to use this information in a proper way. This is another study we did. It's specifically on aquatic animal health, but actually can be considered a proxy for the capacity again of countries to detect and notify and report information. Actually, in this case, what you see on the graph is basically the number of that each country, the number of barriers that they declare as highly impacting, highly blocking the capacity to report information at the national, at the international level. And here the points and the countries are grouped by training level that countries, our focal points, declare to have received. And there is clearly an impact on the training received in reducing the barriers to report at the international level. And finally, collaboration. We discussed a lot about One Health, the importance not only to have tools, but also the importance of sharing this information. Just one number for, there was a very nice report produced by the Quadripartite in 2022, the One Health Intelligence Scoping Study, that one of the objectives was to assess the level of implementation in the real world of the One Health concept at the country level. And the number of countries that declare to really have efficient One Health approach in sharing information was really low. So in terms of conclusion, data and tools can be truly effective if they are built on solid foundation. Data and tools require people able to use them at their full potential, and the collaboration is key. And this was also discussed at the recent World Health Summit in Berlin, that about building trust for a healthier world. Meaning we need not only the tool, but we need a trusted space where we can work together, we can share information. Finally, the geographical differences are very important. Again, Europe, as you have seen from the slide, is a kind of very safe place, I would say. But Europe is not an island, has a lot of connection, and the risk can arrive from surrounding countries, and we are in hyper-connected world. And one of my big question marks for the mood project is how you can replicate this experience in different regions where the capacity to detect health threat is much lower. Something we are also discussing a lot at WOAH level is really the fact, and that's why I think the presentation from Carlene was very interesting, moving from our traditional approach of sharing official data, but also try to find a way of integrating unofficial data, considering all the sensitivity there is in publishing data that are not validated, data that are not published by official veterinary services. This is a big discussion we are having internally. We still do not have the solution for the moment, but for sure is something we need to consider. And finally, I want really to close the intervention thanking actually the Mood project for having involved the World Organization for Animal Health in all the discussion and asking inputs for this project, because it's important for us to be aware of this initiative, to learn, to be able to base our activity on science. There is a very nice sentence at the entrance of the ISS that is said, "Scientia es potentia, knowledge is power." And so we need to have much more knowledge to take the good decision. And finally, also to give us the possibility to provide our inputs from a decision maker, policy maker, the perspective. And I think it was a bit the discussion that closed also the session this morning. And this was my last slide. Thank you very much for your attention.